Are you curious about how a robotic-assisted knee replacement is performed? How about a 1-minute presentation? First, the bone markers are placed. Now, the purpose of the reflective markers is for the computer to know exactly where the bones are in space. Next, I will be registering computer navigation points for templating the knee and guidance for the robot. Once I have the knee mapped out, the range of motion and stability are evaluated. Then the artificial intelligence helps predict the best orientation for the cuts. Precision cuts are then made with the robotic handpiece. These precision cuts are made so that the knee replacement has the best range of motion and stability, customized for the patient. The goal is always to give the patient a well-balanced and stable knee that has great range of motion. After the cuts are made, the trial components are assembled and tested, followed by implanting the final components. Check us out at robotmd.com.